We are going to get started. I wanted to welcome everyone to the webinar. I am your host and moderator. My name is Dr. Lauren Levine. As usual, we've got a great turnout. We've got well over 400 people registered. As always, I start off by saying I hope everyone's staying healthy and safe out there. And I commend all of you for being here this evening. Of course, as we all know, the need for continuing education really is always present in the dental community, and I'm glad to have everyone here. I'm only going to speak for a couple of minutes. I want to make sure that Gory can speak for as long as he needs. Many of you have been on the webinars in the past, so you kind of know how the format goes. If this is your first time here, it's been a while. The way that it works is that I'm going to do the introduction and I'll read his bio. He will present the webinar. We have a little short part afterwards where our sponsor is going to make a special offer to everyone, and then we'll open up for Q&A. When we have 400 people on a webinar, we can't take verbal questions, obviously. So on your screen, you should have a GoToWebinar control panel. You type in your questions as you think about them. We always leave about 15-20 minutes for questions. Sometimes we run out of time. Sometimes we only have a few questions, but if you type it in there, I will do my best to make sure we get to as many of those as possible. In the next few days, I want you to look out for a couple of things. First off, I am recording this webinar, so if you cannot make it all the way to the end, no big deal. The recording will be emailed out to you sometime, usually within a day or two. During the webinar, Gory is going to be showing some of the products that he uses, many of which were exclusive to Golden Dental. I had the pleasure of having Golden Dental sponsor these webinars for, I think, a good 10 years or so. These webinars don't happen without them, because they're the ones that are bringing in these great speakers. They are the ones that are helping to decide what topics that we're going to be talking about. They also handle the continuing education, and it is rare for a webinar to go by where I don't get a bunch of emails asking about the CE. I'm going to mention it at least a couple of times this evening. If you are on the webinar, you will get CE as long as you stay for the bulk of the webinar. I don't know what the exact criteria is for AGD PACE for CE. I think it's around 75 or 80% of the webinar. If you're here now and you're here at the end of the webinar, you definitely get the CE. There's nothing that you need to do. There's no quiz, there's no test, there's no registration. What happens is that when we are done, I will send the list to Golden Dental. They will go through it. They'll see how many minutes. We log everything, how long you were on, when you logged in, when you logged out. I will send that to them. They will go through that list, and anyone that qualifies for the CE will be sent that certificate as well. As you can imagine, with 400 plus people, that does take a while. So I would say keep an eye on your inbox. If you don't have something, say within about a week or so, by all means, drop me a line, and I will make sure that that they follow up with you. So with that out of the way, I am thrilled to have Gory Cottonini back on. I think he did a lecture for us about a year or so ago. He's based in Milan, Italy, but spends most of his time traveling between Europe and North America for dental consulting and education. I was talking with him earlier. His travel schedule sounded brutal the last few days. He's passionate about dental education and regularly conducts clinical trainings on various dental products, including IPR procedures, which we're obviously talking about this evening, to help other dental professionals improve their overall IPR skills and knowledge. Gory brings a unique perspective, being highly familiar with the manufacturing process of IPR strips and why not all IPR strips are created equally. With his global perspective and specialized knowledge, Gory is a valuable asset to the dental community. His presence at dental congresses and exhibitions around the world ensures that he continues to be at the forefront of industry trends and advancements, helping to shape the future of dental care. So Gory, thrilled to have you back and really looking forward to the presentation, and take it away.
Well, thank you, Dr. Levine, and thank you, of course, GoldenDent, for having organized this webinar, and good evening to everyone that is connected with us tonight. So I wrote on this first slide, why should we pay more attention when we talk about IPR? And there's one thing that I really would like to add, and thank you, of course, for the presentation and introduction that you gave of me, but I take things extremely personally. What does that mean? It means that every project that I'm bringing into dental is something that I have experimented on myself, or that was born out of the experience that my wife and I had, because we have a special needs daughter. And so we have found minimally invasive and extremely high quality devices that really can make a difference. And a couple of years ago, I received, no, a bit more, let's say 6 years ago, I received an IPR procedure on myself. And I have to tell you that that experience was not something positive. And as it turned out, I started talking in the dental practices that I visit around the world. When I go around with distributors visiting dental practices, I started talking with patients. And you have no idea the amount of precious information that a professionals can acquire and achieve by talking with patients. And so a lot of patients were complaining about things that were not going well when they had to receive an IPR procedure. And so the next thing I did was I just went on the internet, because as a lot of patients do today, they trust Dr. Google. And so they just type in what they're curious about. And I typed in wrongdoings in IPR and problems related to IPR. And you have no idea what pops up on the internet. And this gave me absolutely motive to find a different solution, because I wanted to be able to supply something safe, predictable, and extremely high qualitative to patients around the world. And so the first images that I'm going to show you people are going to be maybe a little bit disturbing for most of you, because I guess that you're all extremely talented in what you're doing, but these things actually are happening around the world as we speak. And another thing that is starting to concern me is that in North America, we start seeing a huge amount of lawsuits against bad procedures in interproximal reductions. And I don't mean only because maybe you have caused dental hypersensitivity to a patient because you have over-reduced in some cases, but over-reduction can lead to extremely serious problems. And I'm not talking only aesthetically. I'm talking about gum resorption, I'm talking about root resorption, and I'm talking about problems that definitely a patient wasn't looking into having to manage, because only he had asked was to have a nice smile and you just needed to win some crowding. So I'm going to start with some of the images that I have been finding on the internet in the past years. And I think that we all can agree that most patients and most of these things that you're going to see are definitely not what the patient would have wanted. So this is not a result that a patient was looking into receiving. And when you go in something like this and you look at the shape of these teeth, you can definitely understand that this is not a natural biological shape for these teeth, and that I don't think that those brackets and those rubber bands are going to make a difference. Because once you work in this direction, you over-reduce and you damage a patient in this direction, the only way to go to try to fix this is to work with veneers, to work with composites, but that's not what the patient has signed for. So I think that we need to pay very close attention to these kinds of things that are happening as we speak, but we also need to talk about fracturing the contact points. That is one of the biggest problems that today we have when we talk about interproximal reduction. And another issue that we need to talk about is safety. The next image is going to be pretty disturbing. And when I talk about safety, I always try to picture myself, if I am that patient on that dental chair, and maybe somebody touches the elbow accidentally of the dentist, or I need to cough or sneeze. And this definitely can be something that concerns me as a patient, and that's why most patients are scared to receive interproximal reduction procedures, because some things like this may occur and happen. And definitely this is not something that we want to receive. But then going back again to fracturing the contact points is something that happens a lot, especially when you use out of control discs. And I want to talk about these kinds of problems because today it's not only to choose a safe, accurate, predictable, and comfortable interproximal reduction, but it's having the possibility to trust automatic IPR over manual IPR. Because the biggest problem that the interproximal reduction market, if you allow me to call it a market, has had a difficult impact in the past years is that interproximal reduction, of course, started manually. Then it slowly developed into automatic IPR. But a lot of the doctors that transited from manual IPR to automatic IPR got scared because the systems that were offered didn't allow them to have enough accuracy, were not easy to control, were not easy to create a comfortable experience for the patient. We're talking about instruments that transfer incredible amounts of vibrations to the patient that are noisy, that overheat, and sometimes can definitely make an experience unpleasant. So I started looking for a different solution, and I wanted to look for a company that had the priorities switched around. So first of all, I wanted to find a solution that put the patient's comfort back into place number one. And of course, after talking about the patient's comfort, we have to talk about the patient's animal safety that should be at the first place. Because the biggest issue here is that there's absolutely no parameters that are clear to clinicians around the world on how much enamel can you safely reduce on a tooth. And we're going to go into this piece of information in one of the next slides. And DentaSonic is a Swiss company that have been working on these concepts for over 20 years. And they have decided that patients' animal safety has to be the absolute focus of their IPR system. Then they have to be able to offer a precise and accurate treatment. Of course, patient's comfort is central, and we don't have to forget that time saving and satisfaction for the doctor are really, really important. But how can they understand what is really patient's animal safety and how can they deliver a precise and accurate treatment? Well, DentaSonic decided to create a protocol based on two different scientific articles that they have commissioned to two different universities. And to these universities, they asked, first of all, how much enamel can we safely reduce on a tooth to avoid problems, to avoid over-reduction? And then they started wanting to understand how could they create specific strips, engineer them, and design them in a very specific way in order to reduce over-reduction, to avoid cutting soft tissues and hurting the gingiva, in order to create a perfect finishing and polishing, but also a perfect flexibility of their strips to allow a proper biological contouring of natural shapes of teeth. And they have received these informations, and they also wanted to compare this to manual stripping. And so in one of the next slides, I'm going to show you a very interesting slide that will make you understand the huge difference from a patient's point of view into receiving a manual IPR procedure compared to an automatic IPR procedure. But going back to DentaSonic, we have four very simple points. You start going quick and straight through the contact point with the 0.1 strips. And we're going to go into the protocol deeper in the next slides. And this saw is specifically designed to avoid cutting soft tissue. So, I mean, if accidentally you fall on the gingiva, it will not cut the gingiva. If accidentally you intercept the patient's tongue, maybe you have patients with tongue thrusts or with important macroglosses, So you have to consider that the tongue is always around when you're operating, or maybe you can cut the lips, but this strip will absolutely not allow the cutting of any soft tissue. Then, of course, you have to start a gentle correction and reduction of the animal. And I will explain to you during the protocol how the strips have been specifically designed to stay inside safety parameters that have been established by 2 different university studies that you will always have available on our website. And then, of course, you start working after having opened the contact point from 0.1 to 0.5, according to the different thickness classes. And following the indications of the protocol, it's definitely impossible to over-reduce enamel in that patient. And then perfect final polishing. Why? Because burrs have diamond coating on them, because discs have diamond coating on them, and because strips have diamond coating on them. And the diamond coating abrades the enamel on the surface of the tooth. And in those cuts, and we can show you in the researches that those cuts are the perfect hiding places for bacteria, you need to restore that surface and allow that tooth to have a perfectly polished and smooth surface that won't allow bacteria to get in. So let's go back to the research that I was talking to you about. This is one of the 2 researches. So we're talking about comparisons. I'm talking about manual stripping and I'm talking about automatic stripping. And the next slide I always find extremely interesting. This is one of the pages of this research. On the lower horizontal column, you have 9 different orthodontists. 9 different orthodontists that were working in the university, and they are different by age, experience, body shape, body weight. And on the vertical column, you have the amount of force measured in force Newton that is discharged on a patient during an IPR procedure. So they have supplied these 9 different orthodontists manual strips that are the circles, and then they have supplied to the same orthodontist the DentaSonic automatic IPR system. And this makes you understand the huge amount of difference and of discomfort that is discharged on a patient while practicing a manual IPR procedure in comparison to when you take the experience, the body shape, and the body weight of the doctor out of the equation, because you delegate responsibility to a specific instrument that has been specifically designed to avoid pressure, to avoid overreduction, to avoid any kind of human intervention, because it allows you just to accompany the handpiece and the strips, and they will do the work for you. So I think that this is a very interesting slide that should make you understand that maybe what you are feeling to be your comfort zone, maybe it's not a comfort zone for the patients on your dental chair. And maybe you would have to reconsider, maybe take something into consideration of doing something different. So let's go back to the initial question. How much enamel can we maximally reduce on a tooth without causing problems? And this study at the university told us that we can reduce not more than 0.3 millimeters of a proximal enamel substance. So what is 0.3 millimeters? It's exactly the half of the original enamel thickness that is clinically acceptable. So I needed to find a company that had strips that by themselves cannot reduce more than 0.3 millimeters. And DentaSonic has exactly this solution. But before introducing you to the solution for DentaSonic, I would like to share another consideration with you. When we just talked about how much enamel can we reduce on a tooth. And during IPR procedures, in many dental practices, I hear dentists saying that they need to extract pull-out teeth because they need to recover space, that they need to over-reduce maybe in a specific sector because they need to recover space to solve crowdings. But if we consider the 0.3 millimeters of substance that you can reduce, and we consider that on the maxilla, you have 11 contact points available, it means that on the maxilla, you can achieve in obtaining up to 6.6 millimeters of space. And that's a huge amount of space. So maybe you want to start considering that calibrating in a proper way your interproximal reduction or interproximal correction, I don't know how you call it, may be the right solution. And you have exactly the same thing on the mandible. You have 11 contact points and you can gain up to 6.2 millimeters of space in that arch. And 6.6 millimeters and 6.2 millimeters, I can assure you it's a perfectly decent amount of space that can solve practically any crowding with the proper expansion, of course. So when you achieve this, you can win space in lower crowdings, you can win space in moderate crowdings, you can really achieve to do whatever you want to achieve in that patient without over-reducing and without creating problems to that patient. Of course, you can also use interproximal reduction for other things, but I would like to focus mainly on the studies that we have available for you on our website, and of course, GoldenDent has available to supply to you. And there are two very interesting studies. One talks about the adoption of standardized oscillating IPR sequence that tells you that it determines a more regular and harmonious enamel surfaces at the end of the procedure. Of course, inadequate polishing plays a crucial role to guarantee a long-term prognosis and a good respect of biological structures. This article is from the University of Rome, and in Italy, the University of Rome is also the certification center for Invisalign in Italy. And we have been cooperating since 8 years with this university exactly to supply the proper interproximal reduction solution for aligner users and for any other type of intervention on patient. But there's a new study that, oh, sorry. There should be another slide for another study, but I don't see it here. Let's see if it pops up later. Oh, here it is, sorry. There's a new article that came out this year that is even more interesting because I've been talking to you since the start of this webinar that DentaSonic is a very high qualitative and a very high solution to protect the patient's enamel and to protect your safety as well. But I need also to prove this to you. And so we have asked a university, and you find this on Angle Ortho, this article that came out this year, where we have supplied the 5 most diffused strips on the world market, including DentaSonic and other 4. And when you will read this article, you're going to see they have been mounted on a continuous oscillating machine that had them work for 24 hours. And at the end of these 24 hours, but I have to say at the end of the 2nd hour, 4 out of 5 that were presented there were worn out in more than 75–80% of their diamond coating. The DentaSonic strip was still active and was still usable for more than 85%. It had more than 85% of its surface intact. That's why I'm going to introduce you in the end our strips, and this will allow you to understand. Why am I showing you an aligner reapproximation tracker? Because I'm concerned as a patient and as a father about the level and percentage of acceptance of clinical cases without even having been read. There's another very interesting article that I don't have here with me tonight that we have shown at the AAO a month and a half ago, where there's this university that has shared this information that more than 80% of every aligner prescription that arrives in a dental practice is accepted even without being opened or read. And this is an extremely worrying thing for us because we should consider that when we sit on a dental chair, we are in safe hands. And we want you to understand that knowing how to read these informations and knowing exactly how much you need to reduce at which tray number is a very important piece of information that you definitely don't want to take not seriously. And so this is why I would like to explain to you exactly what the IPR prescription that DentaSonic has created will be able to solve all of these problems for you people and help millions of patients around the world to receive safe and accurate IPR treatments. So as I told you in the introduction, we start with the opening saw. You open the contact point with a 0.1 millimeter saw that has a diamond coating of 15 micron. The flexibility of this strip will allow you not to damage the contact points like you have seen in the initial pictures. Most of them were actually fractured immediately. And this will allow you to respect the proper biological shape of the tooth, will allow you to open gently the contact point, but in case you press too much, or in case there's a tongue in the middle, also, if you will hit the gingiva or you will hit the tongue, that saw is not going to cut the soft tissue. Then once you have opened the contact point, there is another specific strip that is a 0.2 millimeter. It doesn't have the saw anymore, as you can see, and we just increase from 15 to 25 micron of diamond coating. Then according to the IPR prescription, so it's the aligner tracker that I have showed you before, or according to your experience, if you're doing this without an aligner prescription, you will know how much to reduce. So if you want to achieve in reducing 0.3, 0.4, or 0.5 millimeters, you will gradually reach those volumes accordingly using the proper strip. And these strips go from 40 to 60 micron. 60 micron is the roughest strip that you will find in DentaSonic. And I strongly suggest you to go on our website and to look at the researches, because on the market today, you find a lot of companies that are selling 90, 120, and 150 micron of diamond coating. And those strips definitely destroy the patient's enamel. And those are really dangerous things to use on patients. So I strongly advise you to take into consideration to use a minimally invasive system, but that has been specifically designed and engineered to allow you to win the exact amount of space that you need. And then, like I told you before, a perfect finishing and polishing with an aluminum oxide strip that will allow you, with 15 micron of diamond coating and an incredible flexibility, to properly contour the tooth of the patient and provide that surface with an even better surface than natural enamel. And this, I strongly advise you again to check the microscope images that are present on the researches on our website. And this will make you understand the level of perfection that you will be able to grant that patient. How can you enter the DentaSonic world? Well, of course, you will talk with GoldenDent and you will be able to start. If you're an aligner user, we have the perfect set for you, because this set has been specifically created for aligner users. You have the exact protocol inside. You have from 0.1 to 0.5. And an important piece of information that I forgot to share with you: why 0.5 is the biggest strip that DentaSonic has? Because we have talked before that the maximum amount of enamel that you can safely reduce on a tooth is 0.3 millimeters. So the 0.5 strip is exactly 0.2 on one side and 0.2 on the other side. So you will be 0.05 millimeters safer than the limit and the safety zone that is indicated by the university studies. So this should make you understand that there's no possibility to over-reduce with the DentaSonic system. So back to the aligner set, you have the strips from 0.1 to 0.5. You have 3 finishing and polishing strips. You have the handpiece, you have the measuring gauge, and you have the strip remover. Please remember that the strips from DentaSonic are sterilizable and reusable between 20 to 25 patients according to the level of persistence that you use, to the learning curve that you have achieved in understanding how to properly use the system. But the average use is between 20 to 25 patients. The finishing and polishing strips are disposable. But I have to be honest, a lot of our customers are using the disposable strips maybe once, twice, or at least 3 times because of the high quality of the diamond coating that they have on top. And of course, they are all sterilizable. Let's say that you are not only an aligner user and you are also a dentist or an orthodontist that works with class 2 restorations, that works with veneers, that works with posterior buildups and composite, and you need a wider range of strips. So you can have the specific strips for aligners, you can have the single side coated strips left or right, you can have the single side strips for finishing and polishing left or right, you can have some specific burrs to remove bracket glue or to contour properly in the posterior sectors. You maybe also want a tray to sterilize these strips, and maybe you also want a second reciprocating head, so when you send one to be cleaned, you can continue working with the second hand. And so the professional kit number 2 will be your choice. And then the IPR evolution that we have launched in North America in 2024, and for the moment is available only in the United States. It's FDA approved. We're patent pending for, we are pending Health Canada approval for Canada. We should receive it between October and November. So I'm really looking forward also for our Canadian customers to be able to purchase the IPR Evo 1. We have launched it in 2023 in Europe. It has been a huge success because with a single handpiece, it's a portable cordless handpiece. You can perform interproximal reduction. You can work in finishing and polishing. And with the same handpiece, you can also changing the head. You will have to order a separate head, always from DentaSonic. You will be able to use it as an endomotor. This has been a bestseller in the past year and a half. It has gave us the opportunity to enter some very interesting new markets. And we are also working on another head, but I cannot still give you the heads up on this information. But we'll soon work also on the 4th head, so you will have really a complete set of solutions in one single handpiece in your dental practice. Of course, it's important to understand how to insert the strips properly. I just put this picture here, but you have to know, and you can ask for these videos and GoldenDent. You have specific videos on how to insert the strips, on how to remove the strips, on how to set the handpiece, according if you are attaching the handpiece to your slow speed motor on the dental chair, if you're using water, if you're not using water, or if you're purchasing the Evo 1, you have the opportunity also to have the video on how to properly set up. But please remember that the Evo 1 arrives with a presetting for IPR. And it's also very important to understand at this point, what is the impact on the patient? So this is a courtesy video from Dr. El-Giriani he's a KOL Invisalign Platinum Elite in Dubai. And he's been working with DentaSonic since many years now. So allow me to show you just a couple of seconds. These are very long videos. You have them available on the website. GoldenDent has them available, so you can obviously request them. But as you can see, This is one of our handpieces with water, and you feel and you see that there are no vibrations transferred on the patient. The patient is not discomforted, and all the doctor has to do is to accompany gently back and forth the strip. So you don't have to apply any kind of pressure. Your job will only be to go back and forward with your hand, adjust the strip that you can rotate 360 degrees, and that's very comfortable also for the posterior sectors, both upper and lower, and it will allow you to work in an extremely smooth way. Of course, we can also watch a bigger strip. This is the 0.5 strip. So this doctor will have started from the 0.1, he will have opened the contact point, then move to 0.2, then to 0.3, then to 0.4, and finally to 0.5. As you can see, the strips are incredibly flexible, and they allow you to properly contour the biological natural shape of the tooth. Of course, you will have inside of every kit the measuring gauge. This will allow you to understand if you will have reduced the proper amount of enamel and you have achieved in obtaining the amount of space that you want to achieve in obtaining. So also this is available with GoldenDent. So to go towards conclusion, I strongly would like to remind you that a proper maintenance is what guarantees a long life for your reciprocating head. So you have to clean the head with oil every day after use. And there is a specific video that will explain to you exactly how to lubricate the head. We supply both 1-year and 2-year warranty, but you have to understand that if daily lubrication is not made, warranty will not be valuable. And sometimes handpieces are returned to our company, and when they are opened, it is absolutely clear that no proper maintenance have been processed on that handpiece. So you're working with an incredibly precise instrument with a very high quality instrument, and so a proper maintenance is what will guarantee a long life to your handpiece and to your work. Of course, let's get to the strips. So we have all our strips come in 12-piece package or in 5-piece packages. You have the aligner assorted set because most aligner users are more comfortable in buying directly the complete set from 0.1 to 0.5 with 2 finishing and polishing strips. With the 5-pack, you only have the 0.1 to the 0.5, but then you can have, of course, the 5-pack also for polishing strips. But if you only need to reassort or the 0.1 or the 0.2 or the finishing and polishing, or only the left coated strips, or only the right coated strips, you will be able to do this because every single reference has a 12-pack or a 5-pack set of strips. So this was my presentation. I hope that I have intrigued you enough to make you understand that there is a safe and predictable way to process IPR, avoiding any kind of over-reduction, protecting patients' enamel, and of course, protecting also your safety as a doctor, because we definitely want to avoid problems towards our patients. So thank you again for the attention. Thank you to GoldenDent. Thank you to Dr. Levine, and I'm now available for your questions.
Thank you so much. So I know some of you may have popped in a few minutes late. I wanted to reiterate that the webinar was recorded, is being recorded. That should go out in a couple of days. CE credits are given for people that have been here for the bulk of the webinar. It doesn't make a difference if you showed up a few minutes late, as long as you're still here now and you haven't just logged in 6 minutes ago, then you will get the CE credits. That's all handled by GoldenDent. That usually takes about a week or so. When we have 400+ people on a webinar, they've got to go through the list and see how long you are on for. Speaking of GoldenDent, I had mentioned this previously. They are the ones that are bringing in these amazing speakers. Every time we do a webinar, they are kind enough to do some type of special offer for everybody. So I'm going to turn it over to Kurt Lawler. Kurt's the head honcho over at GoldenDent. He's going to review some of the things that how they're involved with this system and make a special offer to everyone and go from there. So Kurt, take it away.
Sorry about that. I could not get off mute. I apologize. So let me pull up my slides here. So sorry about that. So GoldenDent we're a Detroit-based dental company, and if you're not familiar with what we do, we started with the physics forceps, which was a unique, unconventional instrument, and we've stuck with that philosophy of providing simple, predictable, and unconventional products in dentistry that sometimes are different, just like the DentaSonic system, but that clinically work. And so the DentaSonic products, I just wanted to show quickly where they are located on our website. There's a restorative section, and then if you scroll down to the IPR and restorative strips, you'll see the DentaSonic Auto IPR, and you'll find the products that were shown this evening by Gory. So this is the new handpiece that was mentioned, the IPR Evo. And so we do have those in stock and available. This is a nice solution if you want a cordless handheld solution for using the DentaSonic IPR strips. And then of course the kits that were shown, we have those available also, which is going to be more of a handpiece driven system, which were already explained this evening by Gory. So if you saw a kit in the presentation and you don't see it on the website, just let us know. We do have all the systems available. So as a thank you for joining this evening, and to encourage you to try maybe a new IPR system or try IPR strips for the first time. We do have 15% off discount code, which is DS for DentaSonic. So it's DS IPR. And so that code will allow you to save 15% off on the DentaSonic brands, which you can find on golden-dent.com, or you can give us a call in the office and we can further clarify any questions you have, share any of the studies that were mentioned this evening in the presentation, or send more videos for your review. So one thing I wanted to mention is usually when I have everybody's attention, I just wanted to mention some other related restorative products that we do have. We find that a lot of our customers will join the webinars every 6 to 8 weeks or so, and sometimes they maybe don't see some of the new products we have on our website. So I usually like to just take a couple minutes just to share some of the new products we do have, why I have your attention on the webinar. So these are restorative related ones. So this is going to be our new O-Star Pro curing light. Goes well with the IPR system, especially if you're using the polishing strips for class 2 restorations. This is going to be the new O-Star Pro curing light. And so this is going to be the next generation of the O-Star curing light that a lot of our customers may be using already. And I just wanted to show one thing that's really interesting is the O-Star Pro changed the head, where they have 29 blue and purple LED chips. And it's really quite interesting. You'll see the beam there at the bottom left of how the O-Star Pro does cure the site compared to the regular O-Star in the middle, and then some of the popular USA brands of what their beams look like. You get a real good uniform beam from this O-Star Pro. So here's the light. It's a new stainless steel aluminum body. Aluminum body. It's going to be durable, drop protection. It's going to have all the same features as the O-Star that you're familiar with, but this is going to have some of the improved uniform beam features on the O-Star Pro. Just two other things. Again, I know this is a little bit off topic, but I usually do this on the webinars at the end. Again, I'm just mentioning some new things quickly, just in case you haven't checked in a while on our website. This is a product that we have that's been successful on the left. This is the new PTB air polisher and scaler system. So this is going to provide you to do what they call the Airstream biofilm clearance, is what the protocol is called for this system. It's compatible with other popular brands that you may be familiar with in the market with their powders. And this is going to allow you to do the same type of procedures of ultrasonic scaling and air polishing in one unit for a fraction of the cost. So it looks like with the promotional code, it's listed there in red. And then they also have a handheld version, which is relatively inexpensive, but much less expensive than some other brands out there. I'll go through this very quickly. So extractions and grafting is where we started. I'm only mentioning this for people that aren't familiar with GoldenDent. We have a full endodontic endo line with endo motors, an implant brand, and then I'll leave it at that. So I'm trying to stay on topic, but we do have the DentaSonic brand. We're very happy with it. We've been testing it with a lot of our own opinion leaders. The feedback's been great since we started. And if you're interested in using the system, use the code DSIPR. And you can find that at golden-dent.com or give us a call in the office. And I'm going to turn it back over to Lauren to go over any questions that were submitted this evening, and they can be answered by our speaker this evening, Corey.
Thank you, Kurt. So Corey, we do have a few questions. Are you ready to get started here?
Absolutely, I'm here.
So one question, it was, I guess, kind of a combination comment question, is you talked about kind of the maximum enamel that you want to remove is 0.3 millimeters, but is that an average? Because wouldn't the enamel, say, on a posterior tooth be significantly thicker than it would be on an anterior tooth?
Yes, that's an average, but you find the exact measures tooth by tooth on the research that is on the website or that GoldenDent can supply.
Got it. So you, I guess this question was similar to what you just talked about. So in your opinion, like 0.3 is pretty much the max it should be in any situation.
0.3 is what has been identified as the security parameter where we want to stay inside to avoid any kind of over reduction.
Okay. So, keep that in mind, and this is obviously a relatively new system. In the past, how did people figure out how much enamel they were actually reducing? What was the criteria that someone would use to be able to do that?
This is a very good question, and I have to say I don't have an answer for that, because I discovered this, as I told in the beginning, by talking to patients in waiting rooms, and then by receiving an incredibly discomforting experience doing an IPR procedure. So I started looking into, like I did for other projects that I have brought, as I said in the opening, they all come out from personal experiences. So my goal is always to find something that has caused discomfort to me, or that I think it can be improved, and to look if around the world there is actually a company that has had the same idea, that was looking in this direction. And I have to tell you, Lauren, that right now we are distributing in 55 countries around the world. So it appears that it's a winning way to talk about patient protection and supplying something that can allow you to perform a safe and accurate treatment, because this is really what patients are looking into.
Do you find, and I think I probably can guess the answer to this, that using the IPR motor system is quicker than, say, a manual procedure? Like, how long did it normally used to take you for a manual, and how long does it take you with an IPR system, with the motor IPR?
Well, you always have to consider that experience plays an important role in this. And when we talk about switching to an automatic system after you have been working manually for many years, maybe you will need a learning curve. But doctors that have started using the system and now are using it since years, they declared that in the timing of a manual procedure, today they're able to perform up to 3 automatic IPR procedures. So the time would be 1 to 3.
Wow. Okay. Significant. The saws that you use with your system, does it have to be with that handpiece, or if someone already has a reciprocating handpiece, are they interchangeable?
No, the saws are specifically designed for the DentaSonic handpieces. I know that around the world there are a couple of handpieces that are kind of compatible, but we strongly suggest to use our handpiece with our strips. On the other hand, you can, if you want to use our strips, but you are still not fully convinced to switch to automatic IPR, you can also use them manually, because you want to test maybe the quality of the strip because you're a manual stripper. And then once you will have tested them, you will start understanding that at the end of the day, you want a handpiece and you want not to have also your arm aching at the end of a full day of interproximal reduction. So I think that the best solution is to find the perfect combination between our handpiece and our strips. They have been designed and engineered to work marvelously, and we have an excellent quality price ratio. So it's very important also this. Products are high quality, you can reuse them. As I said, the strips up to 25 patients. This is pretty peculiar on the market. Most strips don't reach this amount of opportunity. And the hand pieces are very good quality. So I think that this is the perfect solution. As of today, this is the best I have found around.
Okay. Is there something about the design of the system that allows you to avoid damage to the gingiva? Because you did say that there really is no issue with your system with gingival damage.
No, there is no issue, because the only saw that has a saw, that's why it's called saw, is the 0.1. It's a dia saw and not a dia strip. And let's say the triangular shape of the saw, it's not triangular shaped. If you will look at it very carefully, it's more shaped like a wave and not with acute angles. And this allows exactly to open the contact point, because you, as I said in the opening, you don't want to fracture that contact point. You want to go through it in a gentle way, respecting the natural shape of the tooth. But of course, sometimes there are really tough crowdings. And I know that a lot of doctors are working in mouths that are quite challenging these days. But let's say that you're applying a little bit too much pressure. The safe thing is that if that strip falls on the gingiva, it won't cut it. And this is something that Kurt saw me do, especially when we are at exhibitions. I personally put the strip in motion on my tongue or on my fingers or on my lip, and I keep it there for seconds, and it doesn't absolutely cut the soft tissue. And I can assure you that cutting soft tissues is one of the biggest concerns of doctors, and it's one of the main reasons why they're scared to pass from manual IPR to automatic IPR.
Okay. The strips themselves, can they be reused, and if so, how many times?
Yes, as I said, you can sterilize up to between 20 and 25 patients. And this changes according also to how you have learned to use the strips, or how intense that IPR procedure has been compared to another. Let's say that the average is between 20 to 25 patients. And I'm talking about the strips from 0.1 to 0.5. If we're talking about the finishing and polishing strips, these are disposable. As a company, we declare them disposable. So you use them on one patient and you throw them away. I also have to tell you that due to the high quality of the strip, some doctors use them a couple of times.
Okay. I think this question is probably more for Kurt than it is for you. Kurt, I know a lot of the things that you sell through GoldenDent have a money-back guarantee. Is that similar with this as well? Is there like not like a trial here, but I know in the past you typically offer a guarantee if someone's unhappy.
Yeah, that's a good question. I guess that's a good question. You're right. I mean, we do have very favorable, trial periods on pretty much all of our products at GoldenDent. I'm just trying to think, from a strip perspective, some of them, I guess, if the strips are opened and used, we've looked at those sort of like burrs and, have a hard time taking those back. But
Yeah, that makes sense.
I mean, Gory, I mean, what are people doing historically, I guess, on the policies?
What we can do is that definitely I can supply you some sample strips if doctors want to try the strips. And
well, Gory, I guess what they're saying is if they buy the kit,
yeah.
The Evo handpiece or the handpiece itself, a lot of products we've been doing, at least 15 days or whatever it may be. What experience have you had with that, I guess, as far as trial periods on the product? We haven't had those come back yet like that, so.
No, we definitely don't have those come back. And I have to be honest, it's not something that I've ever been asked, but if you want me to look into it and to consult with the mother company, I can definitely look into this. I'm pretty sure that their answer, given the quality of the product, will be a no, but I can go in that direction. What I can do, if you want to have a couple of hand pieces to hand out as test, we can definitely supply those. So if somebody wants to test a couple, test one, you can have available one or two in your company for your customers that they can be able to test and then to send back. Absolutely, yes.
That's very generous.
Yeah, Lauren, I apologize. I didn't give a great answer on that. I mean,
No, I think that's a great answer.
I know it for like.
It was one person that asked it, and I will, when I send you the report, you'll be able to reach out to that person directly, and then you can.
I know the answer for that for pretty much every product, but we really haven't had that come up with this one yet.
Okay, it looks like the last question so far. So you talk, Gory, about really making sure that you respect that contact point and you're on the safe side. So what does that actually mean? Is it the amount of pressure you're putting on it? How do you really do your best to preserve that contact point?
It's a combination between not applying too much pressure and using a strip that allows you to be flexible when you enter it. So this is the important thing. A lot of solutions that are used are extremely aggressive. They are rotating extremely in a fast way, or they have too aggressive coatings, and this will cause the problems that we have seen in the first slides. So if you use a solution that has been specifically designed to avoid these kinds of problems, and you follow instructions, because we always have to remember, and I'm one of those people, so I have to admit I'm guilty as well, that when I buy something new, not always I look at the instruction manual. But in this case, I strongly advise there is a QR code on the box. You just scan it. There's a small booklet inside if you're not a tech guy. And we have everything also available for you. We have short videos that can train you. We can connect remotely to support you with the setup and everything, and this is absolutely free of charge. I've been doing this for many customers in North America that maybe they are not really tech people and they need support maybe in programming the Evo 1, and we're absolutely available to connect remotely with the office, or in those areas where we work with distributors like with GoldenDent, they have sales teams that are there to support you that have been trained by us.
Okay. We are out of questions and we're at the top of the hour, so perfect timing. So Gory, I'm gonna push it back to you to some parting comments, and then we'll wrap it up and call it a night.
Well, so I have to say thank you again to GoldenDent for having organized this. Thank you to Dr. Levine for having accepted me as a speaker, although I'm not a clinician, but I strongly try to promote and to talk about things that I truly care. And you have seen this in all of my companies, all of the companies that I represent. This is a project that is called ATFC that I'm bringing worldwide. It's been now with Canada and United States, it has reached 28 countries as a global project. And so every time I have a chance to introduce at least one of these solutions and allow people to understand that there is a way to deliver extremely high quality procedures and treatments using certified and extremely high quality products for the well-being of patients doesn't mean that you're investing millions to do this, because you can work with good quality and you can work to satisfy the patient needs by looking for something different compared to what you are using at the moment, maybe trying to understand more. And one last piece of advice, if I may, there are many doctors connected with us tonight. Talk with your assistants, talk with your dental hygienists. They are the two figures inside your dental practice that talk the most with the patients. And patients' concerns are important because they can definitely lead you to be patient-focused and to be considered like a referral point in the area where you are living. And this is very important for families and for children especially. And I discovered this. I am a person that I never had caries. I never wore brackets. So I'm a terrible customer for a dentist. And I discovered the dental world around my daughter. As I told you in the opening, she is a special needs patient. And I have really discovered how important it is to have a beautiful relationship with your dentist and to have a dentist that really takes good care of you. So thank you for allowing me to share my experience, and I hope that I will be online with you people again, maybe for other projects, and thank you from the bottom of my heart.
Well, we hope to get you back as well, and I wanted to finish up by thanking Gori for his excellent presentation. There was a lot of great info provided to us. Thanks to Kurt at GoldenDent for not only sponsoring the webinar, but for working with Gori to be able to provide this system for people. I would highly encourage people to take advantage of that special offer, the 15%. I think Kurt said it was good until June 24th. GoldenDent is one of those companies that say what they mean and mean what they say. So if you call them on the 25th, that special will not be there. You have plenty of time and to get ordering on it now. As a final reminder, the webinar was recorded. That recording should go out in a couple of days. When Kurt typically sends out the link to the recording, he usually will also reiterate the specials and remind people that they've got a few days to make that order. The CE credits typically take about a week or so. Check your inbox, check your spam. If you don't have it in about a week, let me know. Again, if you were here for the bulk of the webinar, it's all automatic. There's no quiz or test or registration or anything like that at all. I send a list to GoldenDent, and they will handle the CEs from here. As Kurt mentioned, we do these webinars on a regular basis, usually every 6 to 8 weeks. All of you who are here this evening will be sent an invitation for our next webinar. GoldenDent does a lot of great clinical webinars on IPR, obviously, bone grafting, implants, extractions. We've got some great speakers and great content, so stay tuned for more on that. We know your time is valuable. We thank all of you for joining. I'm always available if you have topics that you would like to see on future webinars. I have lots of companies that I work with. A lot of that could be covered by GoldenDent if it's a clinical topic, but I'd be thrilled to present information that people would find value in. So thank you all for your time. Please stay safe and healthy out there, and we look forward to seeing everyone on our next webinar. Good night, everyone.